back. Hi there, I am Lacey. I'm a nursing student here. I've come with doctor's orders to give you some packed blood cells here. Can I get your name and date of birth?
Brad Pitt, 1135.
Okay. And do you have any allergies?
Nope.
Okay, I'm going to shut the curtain for privacy. Perform hand hygiene. I'm going to grab my gloves. Okay, I'll gather all my materials here, which includes my bag of saline, my flush, my alcohol wipes, and I'll go ahead and put my gloves on here. So I'll check expiration and everything as well, just to make sure everything's in check. I would ask my client if they've had any infusions in the past, and if they have, ask if they've had any reactions. And then I am going to get the consent, and doctors talked about blood products, and it looks like you've signed this. I will also do an assessment, listening to, a full set of vitals, checking for edema, INOs, and listening to lungs, make sure there's no crackles. And then I'm going to go ahead and make sure my line is paid. So, have you had any problems with your site at all so far, Brad?
Nope.
Okay. So we're going to go ahead and grab our saline. We'll open that up. We're going to take our alcohol and clean that for 30 seconds. And then we're going to pop that off and push that on. We're going to unclamp, and then you're going to pull this back to get some blood return, and then I can verify I have blood return. And with a push pause method, we'll just push some of that. How's that feel there, Brad? Any problems?
Nope, it feels good.
Okay, so we'll go ahead and clamp that. I'll leave that still connected here. Then we're going to go ahead and spike our bag. So we'll open that up, and we're going to clamp everything. That's the first thing we're going to do. Roller clamp everything up so everything's tight so nothing leaks out. Okay. And then with your sterile or your clean gloves, these are sterile, so when you pull those off, you don't want to touch the tips. You're going to do that with a twisting motion. And go ahead and hang that up here. Okay. And you'll flip this up. You're going to unclamp that until you get some. You're going to fill it up about halfway, so we'll open up this clamp here. Start to fill here. Okay. And it's filled up about halfway. And then you're going to want to prime this next tubing. It's all twisted here. And I'm just going to unclamp that until you see a little bit of flush. Okay, that's open as well. Okay. And then we'll tip this back down, and you're going to tap that until all the water goes back below the filter. Because you do not want any air bubbles in here. Okay, and then you'll go ahead and open this roller clamp because this controls it. So you're going to make sure that your flush comes all the rest way down your line, which it is, and it's dripping. Okay. And you can see in here in the drip chamber, everything's coming through. Okay, so you're gonna get another alcohol wipe, and then you're gonna go ahead and make sure that's clamped, which it is, and you'll pull that off, clean that. This is sterile, so you want to avoid touching that. And you push that on, and then you can go ahead and unclamp that, and then start your IV at TKO or 25 ml. Okay. You can, at that point, you could take off your gloves, say I took them off. I'm going to go to the lab and get my specimen. So, okay, now I've come back to the room. I verified with the lab personnel all the information on my bag. Hi, Emily here. I'm going to be giving Brad Pitt some blood product here. I've got an order for a 3-packed, 3 bags or units of the packed RBCs. And I'm going to verify his wristband is Brad Pitt, male, date of birth 1/1/35. MRN number, is the MRN number correct on his?
Brad Pitt 1135.
Okay, MRN 9877, Dr. D.
Dr. D.
Okay, and then we've got, it was collected 3 days ago. I've got a unit number of 47 FC 62136.
47 FC 62136.
Expires December 3rd of 2024.
Expires December 3rd, 2024.
And then I've got the blood ID number of TZ H1168.
TZ H1168.
And I verified that both within the bag and on his wristband as well as I'm doing this. I've got O, blood type O, and it's RH negative from my donor.
Blood type O and RH negative.
Okay. And we'll go ahead and get ready to spike my, so I put my gloves back on, of course. And these are sterile, so you're gonna wanna make sure that you do this carefully and then don't touch the ends. You're gonna be careful to twist this on. And put that on here. And we're gonna go ahead and close the next chamber because you don't want the bag of shame. And so we're gonna keep this open. Now I'm gonna start to infuse this in. Any pain at all with this?
Nope.
So you're gonna, once it gets all the way down through the tubing to the hand, that's when you're actually gonna start counting from 15 minutes or else 50 mLs to make sure that there's not any site reaction, any rash or shortness of breath or back pain or chest pain, anything like that. How does that feel?
That feels fine.
And then everything looks like it's fine. You could check another vitals as well. Per policy, come back in the room and do that. And that is it.